Good evening, everyone. Good evening. First, I'd like to acknowledge that I am not John Lynch. My name is Angeline Peters-Lewis, and I have the privilege of serving as both the Chief Operating Officer and Chief Nurse Executive at Barnes-Jewish Hospital. And I'm honored to share this special occasion with you, my colleagues, fellow faculty, foundation donors, and friends. On behalf of the foundation of Barnes-Jewish Hospital, I'm pleased to welcome you to the installation of the inaugural chairholder, Dr. Majella Doyle, to the Mid-America Transplant Department of Surgery Distinguished Endowed Chair in Abdominal Transplantation. Let's stop the applause now. This distinguished endowed chair is made possible by two gifts, both from long-standing and stalwart partners. The first from Mid-America Transplant and the second from Washington University School of Medicine, Department of Surgery. Their synergy reflects a day-to-day collaboration that is the reason we have one of the leading programs in solid organ transplant in the world. Dr. Eveline and Marklin, will you please come forward? Surprise.
Dr. Marklin?
Yes. Thank you. Thank you so much. The hospital, the organ procurement organization, and the surgeons work together every day to ensure our patients and their families have extraordinary experiences. The foundation is privileged to steward their investments made with the goal of advancing the mission of the transplant program at Barnes-Jewish Hospital and Washington University School of Medicine. These generous donations also honor the heroic and selfless gifts of our organ and tissue donors. As an endowed chair, as you know, is among the highest honors a physician scientist can receive. The chairs give outstanding researchers like Dr. Doyle and clinicians the ability to pursue groundbreaking work that develops better treatment and technology. The solid organ transplant program at Barnes-Jewish Hospital is world-renowned and has contributed many surgical and medical interventions resulting in better outcomes for patients with end-stage organ disease. Now a little bit of history. It all began in 1963 with the first kidney transplant in the Midwest performed by Dr. William Newton at Barnes-Jewish Hospital. By 1973, Barnes-Jewish Hospital created the kidney transplant program thanks to the leadership and pioneering spirit of a talented young surgeon, Dr. Charles Anderson, who trained under Dr. Newton. In 2009, Dr. William Chapman, who's here with us tonight, became the surgical director of the newly established Washington University and Barnes-Jewish Hospital Transplant Center, bringing all solid organ transplants under one umbrella, including heart, lung, kidney, liver, and pancreas. The unique strengths of many disciplines combined in this center result in improved outcomes for our patients. Over the years, The expertise from this center resulted in substantial growth of the number of patients transplanted and significant improvement of both graft and patient survival. And this growth and strength has enabled a national engagement in policy development about how organs should be allotted and the most efficient use of these organs. That pioneering work is only happening due to our partnership with Mid-America Transplant. In 2021, the transplant liver team performed an all-time high of 151 transplants in 1 year. Incredible. This impressive feat could not have been accomplished without this multidisciplinary center, the leadership of Dr. Chapman, and the skills of Dr. Doyle. And Dr. Doyle, I think of as a clinician myself, how you have the skill of doing both little livers and big livers and do that all with grace. Dr. Doyle, tonight's all about you. And we are thrilled to honor you as the inaugural Mid-America Transplant Department of Surgery Distinguished Endowed Chair in Abdominal Transplantation. Get used to us celebrating you tonight. Since we can't all be together in person to congratulate Dr. Doyle this evening, please enjoy some heartfelt well wishes and special sentiments now.
Hey Majella, congrats on receiving an endowed chair. We're so proud of you. No one deserves this more than you. Your work ethic inspires Amanda, Rory, and I every single day. Congrats again. Love you.
Congratulations, Majella, on receiving an endowed chair. We are so proud of you. Thank you for being the most inspiring, gracious, kind-hearted, and loving woman, role model, and mother. I love you so much, and cheers to tonight.
Hi, Majella. It's a real shame that we can't be there today to celebrate your special day with you, but we're sending our best wishes from Ireland and from the UK. As many of you may not know, I'm currently in my final year of medicine at the University of Limerick, and in fact, my final exams start in about 2 weeks' time. I've always looked up to my big sister. She was one of the reasons I decided to come back and to study medicine later in my career. She's been a constant source of inspiration to me and is always so generous with her time and expertise, especially if I have a question or need help on the next big exam. And needless to say, she has always got the right answer. I imagine she never thought that she'd be so accomplished in her career, but still have her little sister texting her at all hours, asking her to recall what she studied in ENT when she was an undergraduate. It is clear that without my sister as an inspiration and a pillar of support, I wouldn't be here today ready to embark on my medical career. So congratulations, Majella. I hope you have the most wonderful day, and I can't wait to see you soon.
Hi, Majella. Well, your sister is a real tough act to follow, but let me just say that we're really, really proud of you. This is a fantastic achievement, and as we say in the UK, bloody well done. Enjoy the day with friends and family who are able to make it, and we look forward to celebrating in person in the future. Cheers.
Congratulations, Majella. Bye.
Bye.
Hey Rory, do you know that Mommy's getting a new chair for doctors tomorrow?
Well, I hope Molly doesn't eat the chair.
Wait, what do you want to say to Mommy?
Congratulations on your chair. I love you, Mom. See you at the conference.
Dr. Doyle, it's clear that you are inspiration to many, and they're all around the world. You're influencing lives all around the world. On behalf of the Foundation Board, I want to articulate our commitment to stewarding philanthropy that facilitates collaboration and funding that builds bridges to enable discovery, all of which means better patient care. Our sincere thanks to the section of transplantation, Dr. Chapman, the Department of Surgery, Dr. Eberline, and to the Washington University School of Medicine, Dr. Perlmutter. Now I would like to introduce Mid-America's Transplant's President and CEO, Diane Brockmeyer. We are grateful to Diane for her full leadership and the leadership of the Board of Directors. Diane's leadership at Mid-America Transplant is innovative and forward-thinking. Her collaboration and cross-institutional leadership are models for building lasting partnerships. Joining us virtually, please welcome Diane Brockmeyer.
While I regret that I can't join in person today, I'm grateful to have this opportunity to thank the full partnership represented today and to share a bit about why we were inspired to establish Dr. Doyle as the inaugural chairholder. First, this audience of clinicians may be far more familiar than others with words rooted in Greek and Latin. Medical school can have that effect. So you may know that philanthropy is both a word and a philosophy, with its roots in ancient Greek meaning care or love for mankind. That philosophy is our day-to-day work. Philanthropy fuels the partnership between the entities of Barnes-Jewish Hospital, Washington University School of Medicine, Mid-America Transplant, and our entire community. The quality of all life is enhanced by giving. Those who can give of their resources, those like Dr. Doyle who give of their incredible talent, and those who give of their precious organs and tissues so their legacy continues and more lives are saved. This is the greatest possible partnership designed to do the most good with generous gifts. Living the philosophy of the good of all mankind means that Mid-America Transplant is dedicated to innovative new ways to care for more people and save more lives while navigating the space between death and life, work that we are honored to do. We celebrate each and every life in the process, and we are certainly proud to celebrate our bright future, leveraging the inspiring vision and strength of Dr. Doyle. We've had the privilege to work with Dr. Doyle on her research about our Organ Recovery Center, which is now referenced across the industry. Thank you, Majella, for bringing heightened awareness to this innovation. I'd now like to introduce Dr. David Perlmutter, Executive Chancellor for Medical Affairs, and the George and Carol Bauer, Dean of Washington University School of Medicine.
Thanks, Diane and Angeline. It's a great honor for me to represent Washington University School of Medicine in recognizing the accomplishments and leadership of Dr. Majella Doyle. Washington University School of Medicine and Barnes-Jewish Hospital have worked together and benefited over many years from a strong partnership that continues to push the frontiers of medicine. And I also want to thank, as did Angeline, Mid-American Transplant, a longtime partner, and we're blessed to have Dr. Gary Markland, the Chief Medical Officer, here with us today. How wonderful, yeah. How wonderful it is to now have not one, but two distinguished chairs made possible by the generosity of Mid-America Transplant. This professorship also recognizes and honors our shared goal of advancing the gift of life and maximizing patient outcomes through organ transplantation. I was at one point a faculty member at the very beginning of the transplantation journey here in St. Louis. And I hope you don't mind if I say a few words about that. I am usually up here introducing at an installation an endowed chair in an area that is not as close to my heart. In fact, I really was part of the team that started pediatric liver transplantation here at St. Louis Children's Hospital in 1986. This was several years after Dr. Starzl and his team showed that you could actually get sustained survival after liver transplantation using cyclosporin A. So that big breakthrough was published in 1981, and just for all you adult surgeons here, that was proven on the basis of pediatric liver transplantation. So the first studies that were done at Children's Hospital Pittsburgh, and subsequently then at University of Pittsburgh Medical Center, and then all of the major academic centers around the country began to develop liver transplant programs. In fact, I started working with the liver transplant team at Children's Hospital Boston as a fellow in 1983, and became the co-director of the pediatric liver transplant program. And then when I came here, I was drafted by the then surgical transplant team to work with them. And I can say from that beginning that we have come a long, long way here in St. Louis, in no part due to the great leadership of Will, Chaplin, and Majella. And knowing where we came from, in those early days, we were not having the kind of success that we have now. We were not able to do transplants in children safely and efficiently as we do now. And with Majella, well, it comes from deep in the heart and soul to say that we've come a great way forward. Dr. Doyle has worked hard to advance transplant care and is essential to our future as a national and international leader in this important area. Our program is distinguished by a unique but essential demand, operating with the highest of skills, under extreme pressure, and always with tenderness. Dr. Doyle is a master of this blend of science and art. She exemplifies the convergence of technical precision, innovation, and judgment while attending to the families with compassion and love. It is deeply moving for me personally and on behalf of our medical school and academic medical center to honor her as a leader in the field. It's the privilege to join with you all today in naming her the Mid-America Transplant Department of Surgery Distinguished Endowed Chair in Abdominal Transplant. We know she will continue to elevate our school and our hospitals and our entire transplant program here in St. Louis. Congratulations to you, Majella, for your leadership, expertise, and vision, and on this well-deserved recognition. Now, to continue the ceremony, I'd like to call on Dr. Tim Eberlein, Bixby Professor and Head of the Department of Surgery, and Spencer T. and Ann W. Olin, Distinguished Professor and Director of the Alvin J. Siteman Cancer Center and Senior Associate Dean for Cancer Programs. Tim?
Well, this is a great day and a real pleasure. I remember when Majella first came as a fellow and talking amongst ourselves, Will Chapman and Dave Lenahan and myself, that this was somebody who was really special and unique. And you know, over the years, Majella, you have not let us down. So for all of us in the Department of Surgery, it's a particular pleasure to celebrate your installation. Now, as has been mentioned, this installation is a nice collaboration between Mid-America Transplant, the Department of Surgery, the Foundation, and the School of Medicine. And that's sort of what you do in your day job. And, you know, transplant coordinators, nurses, physicians, nephrologists, hepatologists, et cetera. and bring that to bear for the good of our patients. You know, over the years, we've watched you grow, starting out as an assistant professor and dealing with the small little children who needed transplants at Children's Hospital. And in a very short period of time, it was obvious that Majella became the surgeon's surgeon. And you know, I think we're really proud of the technical and judgmental expertise of all of our surgeons. But you know, of all of our surgeons, Majella, you're among the best. And that's something that none of us can ever take away from you. You've earned our accolades, and it's appropriate that you have this endowed chair. Now, I do have to say a little word about Ted and Marie, because Marie may not remember this, but we actually met at a holiday party. And as I said, internally, we talked about, boy, how are we going to get Majella to join our faculty? And so, Majella was not married then, Bob, but came and brought her mother as her date to the holiday party. And upon introduction, I blurted out in probably a pretty direct way, "Oh, I'm really glad to meet you. You know, we are going to recruit your daughter." Which was probably not the smoothest way for us to be introduced. But here so many years later. And Ted and Marie, thank you for sharing your daughter and her prodigious talents with our family. And now we've extended the family across the pond, as it were. And Majella, it's been great to see you grow, become our Vice Chair of Clinical Affairs, and your impact in the Department of Surgery, not only in the area of transplant surgery and HPB surgery, but also as you've helped our department in your role as the Vice Chair for Clinical Affairs. So congratulations. This is a really special day, and it couldn't be any better person who has this endowed chair. So congratulations. And I'm supposed to introduce my other boss, Will Chapman, who's the Eugene Bricker Professor and Head of General Surgery and Transplant Surgery.
Thank you, Dr. Eberlein. I too want to share my gratitude to Mid-America Transplant and Diane Brockmeyer for their steady partnership and generous gift here today. It has really been a privilege to work with probably the premier organ procurement organization out of 58 in the United States, right here in St. Louis. So thank you very much. You know, as everyone here knows and has heard, this is a really special occasion, recognizing a leader among leaders, Majella Doyle. We recognize that she's not only a leader in her specialized field of medicine and is a distinguished faculty member, but also is a daughter, mother, stepmother, and wife. To that end, we welcome her parents, Ted and Marie, here from Dublin, Ireland, and her husband, Bob Roth, who, by the way, is an outstanding scientist. Bob was a collaborator with Nobel laureate from WashU, Charlie Rice, and they discovered the Hep C construct. And their kids, Rory, Amanda, and Ryan. and will share in the pride that you must surely feel today. Thank you for sharing Majella with us. Now, I'll talk a little bit about Majella's time coming here because that was pretty unusual in itself. And that, as we heard earlier, was in 2005. Now, she hasn't just stopped with developing a career in transplantation. In 2012, she received her MBA degree from Washington University. At a time, she was a busy transplant surgeon and full-time part of our transplant team. Her roles and responsibilities have steadily increased since that time. She currently directs the liver transplant program at Barnes-Jewish Hospital, as well as a pediatric transplant program at St. Louis Children's Hospital. As we heard, she's also vice chair for clinical affairs. She's had a lot of research interest in the value, and I imagine we're going to hear about it in a few minutes, of a freestanding recovery center, along with a number of other projects that have had a far-reaching impact really internationally. This chair will ensure that Dr. Doyle has resources to continue this innovative work. Now, I'd like to just share a few facts about our transplant center to give you a little idea of the scope and magnitude of what happens here. The first number or milestone is 10,000. In 2019, our transplant center performed its 10,000 adult organ transplant, a milestone achieved by less than 10% of transplant programs nationwide. We are now the 12th, between the 10th and 12th, depending on when you look, largest transplant center by volume, with excellent outcomes. We've been a transplant center now, well, had transplant programs for over 60 years. We owe a lot to the partnership with all of our colleagues that I really cannot overemphasize how fortunate we all are here, especially with those including the Department of Medicine, hepatology, nephrology, gastroenterology, infectious disease, and others. We could not do what we do without the real strength and breadth of Washington University and Barnes-Jewish Hospital. Now, how did Majella come to St. Louis? Well, this man really had a lot, I would say was instrumental in this happening. And not only was Jerry McEntee instrumental in Majella Doyle coming here, he really was instrumental to me in my career. In 1990, I had plans to go to Bern, Switzerland to do a year of HPB training. In May of that year, Les Blumgard, who I was going to work with, announced he was moving to Sloan Kettering in New York in 3 months. So I really did not have that opportunity, and instead went to King's College Hospital in London for my fellowship time. King's happens to be the highest volume liver transplant program in Europe. Today, I don't think everyone thinks of it this way, but in 1990, liver transplantation was still in its infancy. Vanderbilt University, where I trained, didn't have a liver transplant program. Now, we had had one here, as Dean Perlmutter mentioned, for a few years, but it was still early in the time. Jerry McEntee was there training to develop the liver transplant program, the only program in Ireland. And so we overlapped, and he took me under his wing, so to speak. I got some transplant experience. I returned to Vanderbilt, 2 years doing HPB surgery. 2 years later, the transplant surgeon, one, left, and I was asked to join the team. In 2004, we kept in touch a little bit. 2004, I ran into Majella and Jerry at an international meeting in Washington, D.C. Majella was looking for a place to get some transplant experience. Jerry encouraged her to come and join WashU. So Jerry and his wife Yvonne are here from Dublin, Ireland. to celebrate this event, and I want to recognize them both for being here. Thank you. So I know we want to get on to the talk today. The one point I would mention, we've heard about this a little bit, Dr. Doyle being the go-to surgeon in HPB and transplant surgery. What does that mean? Well, what that means is we have 6 surgeons that practice in HPB surgery, and they're complex and transplant. They're complex cases. Not often, but not infrequently, people get into trouble or they have problems making decisions for patient management. Majella has really become the person people call for help. And, you know, amongst surgeons for complex surgery, I don't think there's a higher compliment to give someone. I think that encapsulates our view about Majella. Angeline, do you want to come and bestow the chair?
Here's the official part. On behalf of the physicians, staff, and trustees of Barnes Jewish Hospital and the Foundation for Barnes Jewish Hospital, I hereby install Dr. Majella Doyle as the Mid-America Transplant Department of Surgery Distinguished Endowed Chair in Abdominal Transplantation. Congratulations.
Join us as well. Sorry, one moment. Come on over, Joan and Gary. There you go.
You got a smile for once, didn't you? Thank you.
Wow. Thank you, everybody. Thanks for your remarks. It's really very overwhelming to be standing in this spot, and truly an honor to stand before you today to accept this incredible distinguished endowed chair. I would like to talk to you a little bit about some of the innovations that we have been doing in transplantation here at Washington University and Barnes Jewish. But before I would start, I would like to give thanks to Mid-America Transplant Services, the Barnes Jewish Foundation, and the Department of Surgery for putting this endowed chair together. It is truly a huge honor. Thanks to Diane Brockmeyer and Gary Marklin. As we heard, Diane is sorry she can't be here today, but she's away accepting the prestigious Baldrige Award for MTS for the second time for their innovations in donation, which is just an incredible achievement. No OPO has done this before. I would also like to thank Dean Perlmutter, Tim Eberlein, and Will Chapman for every opportunity I have been afforded since I came here in 2005. I am incredibly, eternally grateful. I couldn't have imagined a career that I've had so far, with this being by far the most incredible honor. So, what is liver transplantation all about? This is Braley. She was born without the normal formation of bile ducts. It's a disease called biliary atresia. She was extremely sick when we saw her. We transplanted her, and this is what happens. Here she is on her 1-year anniversary, looking at a picture of herself when she was post-transplant in the ICU. And here she is as a 6-year-old, 5-year anniversary, thriving as a wonderful little girl should. And here's Robert. He had PSC. 3 days after transplant, up and moving around. And on his 1-year anniversary, celebrating with his wife. And here's Haley with acute liver failure. All of a sudden, starts getting super sick, gets a liver transplant. And here she is celebrating her 1-year anniversary with her husband and her little girl. We truly have the most amazing job in the world. And thanks to the organ donors and their families, we can pass on this gift of life to these patients. Now, of course, there are some problems. So what are the main problems with transplantation? Well, globally, we have a huge shortage. Less than 10% of organ transplantation needs are met. I'm going to just refer to liver here for a moment. Liver transplantation in the US. This graph illustrates the situation in the US, and if we look at the graph on the right, this shows our average number of liver transplants in the US is around just under 9,000 per year. On the right, however, if you look at the wait list at any one time during the year, there are 25,000 patients waiting for a liver transplant. So there is an enormous gap that we need to bridge. So how do we do this? These are data from the UNOS and the OPTN. This is the national governing body that oversees transplantation in the US. And this data is looking at organ utilization for liver transplantation. And what we can see is that the current liver utilization rate is only about 67% of livers. And these are livers that are actually recovered for transplantation. So we leave, as a nation, a lot of potential organs on the table that we could utilize. So how do we remedy this problem and use these organs? Here are two strategies, both of which have been pioneered here at Mid-America Transplant and WashU and Barnes Jewish Hospital. One is the establishment of a donor recovery center, which drastically changes the way organs are recovered, and which is what we have done in partnership with MTS. And second, which I'll talk about in a little bit, are some new strategies for organ preservation that can help improve organ function. So here in St. Louis, we serve almost 5 million people, 122 hospital partners, and have 4 transplant centers in the area. When we look at the organ donor locations, organ donors are located in the hospitals from 164 zip codes, primarily in 2 areas, St. Louis City and Springfield, Missouri. In the past, or in general, most of the recoveries occur outside of the city and require a fly-out, although some donors are recovered within driving distance. For many of you here who do not work in the field of transplantation, I can tell you the experience of donor recovery is time-consuming and challenging for the multiple teams of surgeons who have to drive or fly to the donor hospital to recover organs for transplant. Multiple teams fly out to these hospital locations for the recovery. The recovery time is often lengthy, it's fraught with delays because the donor receives the least amount of priority in any hospital because there are other patients who need help, traumas and other demands on the operating rooms in the hospital. So when you even get to the hospital to do the donor recovery, you can be waiting around for quite some time before you actually get to do the recovery. This results in extra time, frustration with the families, and general lack of efficiencies. The donor organs are recovered once the recovery takes place, and then they're taken back to the transplant center for transplantation by the teams. Now, in addition to the frustrations and the time taken, what's also interesting is that this is data from published by the Michigan group addressing the safety of organ recovery. And since this was a survey done, and 15% of respondents have been involved in at least one travel-related accident, and over half of these accidents occurred during air travel. And actually, sadly, since 1990, 25 transplant personnel have died in organ recovery-related accidents. So it's estimated to be 1,000 times riskier to do an organ recovery than it is to travel on a commercial flight. So now, the great science of medical technology can only be accomplished by great vision. Groundbreaking advances in surgery are not always a device or a treatment, but sometimes, as in this case, a change in organizational structure as an alternative to the traditional recovery model in 2001, we introduced the concept of moving the donor to a purpose-built facility, an organ recovery center. And here, the donor is transferred from the hospital where they originated. They're transferred to the organ recovery center, which is very close to all of the transplant centers here in St. Louis. And then the organs do a short travel over and back to the transplant center. Now, this is something that does not happen overnight, and in partnership with MTS, this has been going on for over 20 years. The first organ donor was transferred in 2001, and since that time, over 2,500 donors have been transferred and recovered in the Organ Recovery Center. Now, these are photographs of the recovery center. It's just like a mini hospital. There's a cath lab, a CT scanner, they have a plane that can transfer the donor, there's a stretcher in the plane, and this can be configured to carry passengers also. In addition, this is the operating room. It's absolutely state-of-the-art operating room, and with experienced staff to help the procedure go smoothly. So, what have we accomplished in the last 2 decades? There has been a dramatic increase in the number of organ donors within our OPO in St. Louis in the past 2 decades, going from just over 100 donors in 2001 to at the peak in 2020 with 278 donors. And this is from mammoth efforts by all to create a culture for donation for organ utilization. In addition, we have seen a 250% increase in the number of organs transplanted. And this here, in partnership with the great transplant programs here at WashU and Barnes-Jewish, the organ transplanted has also exponentially increased. And this, in spite of the pandemic, while we did see an initial dip in the first 3 months, organ consent for donors decreased by 11%. There was an 18% decrease in the number of organs transplanted in the first few months of the pandemic. And interestingly, donor cause of death demonstrated a 4.5% decline in trauma, which is not surprising with the lockdowns, but a 35% increase in substance abuse cases, sadly, during that time. So what are some of the other benefits of this model of organ recovery? One of our earlier publications on the success of the new model for donor recovery saw several benefits. One of the first benefits we noticed was the impact on personnel travel. So surgeon travel time was significantly reduced from doing a fly-out, which is over 8 hours at a minimum, to less than 3 hours to do a recovery at the Organ Recovery Center. In addition, Because of this, we saw a significant reduction in our teams flying out to do organ recoveries, which is obviously much safer and beneficial. In addition, the amount of time that the organs spend on ice, and this data is for liver, is much shorter by transferring the donor. So the national average for liver cold time, we call it in transplant, is 7.5 hours. And by transferring the donor, we see that cold time significantly reduced to just over 5 hours. One of the big things that we found looking through all of the years of the Organ Recovery Center is a massive reduction in cost of over 50% for organ recovery by transferring the donor. And the earlier we transfer the donor out of the hospital, the less the cost, because we're paying a premium for the donors to be in the hospital, and the facilities are easier to manage by moving the donor out, and the costs are less. Given the enormous rising healthcare costs, this is huge savings. Additionally, because of the cost savings at Mid-America, the cost of the organ to the recipient bill is less, and our organ costs at MTS have been significantly lower compared to other surrounding OPOs for the last many years. But perhaps the most important factor is that we, by transferring the donor, have found that we are able to get more usable organs per donor, 27.5% increase in organ yield, which is absolutely the way to bridge the gap between the organs that are not being used. And it makes sense because when you move the donor to the Organ Recovery Center, the concentration and the focus is on the donor at the donor center, unlike in an acute care hospital where there's all sorts of other stuff going on, and as I said before, the donor receives the least amount of attention. Here at the Organ Recovery Center, we are able to maximize the lungs, maximize the heart, take the time that's needed to get these organs into the best possible shape so that they can be used and save the lives of the recipients who need them. Now, as a result of this groundbreaking work, we are leading the way in organ recovery in the United States. And as a result of the work that's been done here over the last 2 decades, there are now 23 such organ recovery centers nationally, and this is growing. At the end of 2020, 4,500 donors had been transferred to freestanding centers throughout the country. This is for sure the way of the future for organ recovery. One of the things that we have to remember is that these donors are brain dead and they're being transferred out of the hospital where they've died. The donors and their families are the heroes in this process, and each donor is remembered by a procession lined by the staff taking care of them as they proceed to Mid-America Transplant Organ Recovery Center. In addition, while the families are not typically at the recovery center, families' wishes are encouraged. Music, religious articles, and here in this picture, a letter from the donor's family is being read in the OR before we start the recovery. It's a very moving process, and I can personally attest to that. And every year, the donor families and the recipient families, some of them have met, some of them have not, but they gather together to celebrate life and to celebrate the gift of life that these donors gave at the candlelight celebration. So I'm going to change tack for a few slides and talk a little bit about how we can improve organ function after they're actually recovered from the donor. So this is talking a little bit about organ preservation. So it's a pretty new idea for liver transplantation, normal thermic machine perfusion, where you take the liver from the donor, it's placed on a pump, and warm blood is perfused through the organ. These systems are to assess the viability of the organ after they are removed from the donor. There's two types currently being investigated: hypothermic perfusion, which is cold perfusion, and normothermic perfusion, which is warm perfusion. There have been some studies show that these machines can improve performance in some marginal meaning not perfect organs. One of the great things about being at this medical school is that we are really able to think about the fundamentals when it comes to our research. And we have made huge progress, not only on thinking about perfusion for marginal organs, but we're actually doing this for organs that have been discarded. We started an FDA-approved protocol about a year ago to look at organs that were deemed to be discarded. So these are organs that have been turned down by other centers. And we put them on the machine using machine perfusion to assess their viability. So far, we have recruited 15 livers. 4 did not pass the viability test, and so they were discarded. The rescue rate was 73% because we went on and successfully transplanted 11 of these livers that ordinarily would not have been used. And this study is ongoing, and we're very excited about the use of normothermic perfusion in the future. We believe this is going to help us recruit livers that we are already turning down. And in my final few slides, I want to change tack one more time to talk a little bit about cancer. I would like to talk about some of the pioneering work we are doing in the treatment of liver cancer. Liver transplantation was originally conceived as the ideal therapy for hepatic malignancy because it allows for removal of advanced tumors in the whole liver and also any potential sites of recurrence. It is the only solid organ where transplantation is considered appropriate in the setting of certain cancers. However, early cases were dismal, and it was actually a contraindication to consider transplantation for cancer until the last few decades. For the last 2 decades here at Washington University at Barnes Jewish Hospital, we have had a very innovative and aggressive approach to advanced liver cancer in hepatocellular carcinoma, cholangiocarcinoma, and in colorectal, and now most recently in colorectal metastases. HCC is a deadly disease. Patients with early stage disease have, however, been shown to benefit from transplantation. However, there are so many more patients with more advanced disease that have limited or no options for treatment. Now, we have shown that patients beyond early stage disease with HCC, who are otherwise candidates for liver transplant, should undergo aggressive attempts at downstaging and then transplantation. We also looked at more than 1,000 patients from 7 different centers in a multi-center fashion and verified our original findings that patients with more advanced HCC who respond to treatment do very well with liver transplantation, and that the current restrictions that are in place to limit transplantation for early stage disease are too severe and restricting access to transplantation for many patients. In addition, we've had a long interest in looking at transplantation for Hilar cholangiocarcinoma. This is a rare disease, but most of the time when we see patients with this disease, they are unresectable. We have had a protocol in place for some years, and we recently published our results showing that liver transplantation provides a 50% 5-year survival for candidates who otherwise would have no surgical treatment option. And this is, I think, what's a very important thing to understand, is that these are patients with no resection option, no surgery option. Transplantation, if it's possible, is the only thing that we can do. Now, this has sparked our interest in other kinds of bile duct cancer, cholangiocarcinoma, that actually grows within the liver parenchyma. And again, because these are rarer cancers and there's no national guidelines for transplantation for these patients, we have to do it under protocol. And we are using livers that have been discarded that we're putting on the normothermic perfusion through the RESTORE trial that I talked about a few minutes ago in order to bring these patients to transplant. And to date, the slide is incorrect, it's 11 patients have been transplanted, and out of those, 4 of them have had intrahepatic cholangiocarcinoma. And again, these are patients who, again, would have no other options. And finally, the latest endeavor we have been doing for liver transplantation for cancer is in patients who have colorectal cancer, where they've had their primary colon cancer removed, but they have tumors in their liver. Most of the time when tumors are in the liver, we try to remove them and leave part of the liver behind. But unfortunately, for many of the patients we see, removal of the liver, resection of the liver is not possible. And due to some early data from the Norwegian groups with success in transplantation, we are really breaking ground here in the United States by being one of the first centers to transplant patients who have a history of unresectable colorectal metastases. In our experience here so far, we've done 6 patients, the median follow-up at 13 months, and the 6 patients are alive and well. So I think as a result, I feel, of these innovations, we are extremely proud to have become a national center of excellence for transplant oncology, with referrals coming from across the nation. As you can see on this slide, between the years 18 and 21, this is data from where we're seeing referrals from both East to West Coast, as well as the Midwest and the South. So, in summary, there is a great disparity between the need and the number of organs available. We are bridging the gap in 2 main ways. With innovations pioneered here in organ recovery, we are increasing the number of organs transplanted per donor to save more lives. And this method of recovery is now being utilized nationally in more than 23 locations and growing. Additionally, by using our understanding of the physiology of the liver, we can make a prediction on the viability of an organ by using normothermic perfusion and increase the potential use of discarded livers to try to bridge the gap between those who need and the number of organs we have. And finally, in cancer, we really feel like we're breaking new ground, using the science of transplant and the biology of cancer to apply to unresectable liver cancers to treat patients with no surgical options with great outcomes and providing hope for the future of so many. Through the foundation of Barnes Jewish Hospital, grateful patients and their families share gratitude for the care they have received through giving. And I would especially like to thank the Levinson Munoz family and the Goldpaler Anthem family for the philanthropic support of transplant research to improve the health and well-being of our patients. Thank you. So to finish, if you will indulge me for a few more minutes, Angeline, I would like to thank again Dean Perlmutter, Tim Eberlein, and Will Chapman, Mid-America Transplant, and the Foundation. I also want to thank the courageous donor families and their wonderful act of generosity. And I implore you all to sign up if you are not already to be an organ donor. It only takes 2 minutes. Transplant is only possible with an enormous team. This picture, because we've had COVID and the pandemic, we haven't been able to take a picture of our whole group for 2 years, more than 2 years. So I don't have pictures to describe everybody and to thank everybody, but our team is amazing. Our colleagues, our fellows are incredible. Our team, our APPs, I see them all sitting up there, are amazing. Our team in children's are just phenomenal. We're so lucky to have such a great team. The administrative leaders, Jean, Heather, and Martha, Steph and Lindsay and Cassie, I don't know if she's up there, and all of the people from Children's. It takes a village here and a village in the Children's Hospital to make transplant work. And we are so lucky to have incredible teams in both hospitals and both transplant centers. Now, I know Jerry McEntee is getting a little bit too much press than he would like today, but I do have to thank him because he's the reason I'm here. He built the transplant program in Ireland as a renowned HBB surgeon there, and in addition to that, he is a national hero in Gaelic football. He taught me so much about surgery and about life as a resident in Ireland. I'm eternally grateful for his friendship and for him and his wife Yvonne for making the trip today. I would also like to thank Dr. Ralph Dacey, who's up there at the back, who has been an amazing source of counsel and friendship over the last few years. I thank him and Corinne for being such great friends and neighbours. It's been a pleasure knowing you over the last few years. Now, finally, I have a few other personal thanks to make. Firstly, my parents, who put up with me leaving Ireland in 2005, although I don't think Dr. Eberlein gave them too much choice. I did come here, though, only for 1 year. I will preface that, and here I am, nearly 17 years later. They taught me so much about the value of life, and I am only the person I am today because of their guidance and their values. I want to thank my siblings, Sarah and Howard, and their spouses, who are so sorry they can't be here today, but as you heard, they're celebrating, and they're here in spirit. I need to thank this amazing woman, Indina Launahemia, who came from Namibia to help us mind Rory when he was a baby. She is now a huge part of our family, and we are so proud of her, having recently graduated in her degree. I thank you, Dina, for your friendship and for everything you've taught us and for your love for our little boy, Rory. And to my husband, Bob, somehow the universe helped us find each other. I love you more than I can ever express in words. And I thank you for being an incredible rock of support to me and to our family. Thank you. And finally, last but by no means least, these three incredible children who surprise and delight us every day. Ryan, the incredible hockey player who you saw earlier on the video, can't be here because he's stuck in playoffs in Canada. Ryan, we love you and we miss you, and we're so proud of all you have accomplished in your young life so far. Amanda, who is a sophomore at SMU. I cannot wait to see what you do with your life. You are incredible, a superstar, and we're so proud of you. And lastly, my little Rory, my superhero, he's probably going to kill me for saying that, who at present is very undecided as to whether or not he's going to be an artist or an Olympic skier. We love all three of you so much, and we're so proud of everything you do. Thank you. And this is the view from our house in Ireland, and I have it on my desktop because it reminds me of home, and I'm very lucky to have two amazing homes, one here in St. Louis and one in the beautiful country of Ireland. So thank you for indulging me and listening to me today.
Dr. Doyle, you asked for 2 minutes, but we could listen to you all evening. After that extraordinary presentation, it's clear, again, once it reinforces to us all why we're here tonight to honor you. It's clear we saw from that extraordinary presentation your passion for the work, your command of the state of the science, your commitment to innovation and discovery, and also your commitment to your patients and families that you serve. So thank you for all that you do. We are truly honored to award you the Mid-America Transplant Department of Surgery Distinguished Endowed Chair in Abdominal Transplantation. It's a great title. Tonight, you helped us look back, but we want to look forward with you to the many innovations you and your colleagues will continue to develop to advance the field of transplant to provide patients with exceptional care. Thank you, colleagues and friends, and everyone for being part of such a special installation ceremony. Before we go, I also want to take this opportunity to thank Susan L. and the amazing team at the Barnes-Jewish Hospital Foundation. You all have done an amazing job making sure that this evening honoring Dr. Doyle was special. Finally, congratulations, Dr. Doyle, and thanks again to your beautiful family for sharing you with us and for being here with us tonight. Good evening, everyone. Thank you for joining us.